Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. The current 5-day test positivity rate is 1.45%, and 35 new cases of COVID-19 have been identified as of 9:30 a.m. This brings the total number of lab-confirmed positive and probable positive cases in Manitoba to 542. We have 6 current hospitalizations with 3 individuals in intensive care. 182 active cases, 352 individuals have been listed as recovered. The number of deaths due to COVID-19 remains at 8. The preliminary testing numbers show 756 lab tests were performed Saturday, bringing our total number to 100,830. I can confirm that of the cases announced today, there are 7 confirmed cases of COVID-19 connected to a business in Brandon. The cases are currently self-isolating and contact tracing is underway. At this time, there continues to be no evidence of workplace transmission. However, the case investigations are continuing. This company is going beyond public health recommendations and having larger number of workers self-isolating than as recommended from public health. In addition, workers have been cohorted to reduce risks. Public health officials, workplace safety and health, agriculture and resource development, as well as the Canadian Food Inspection Agency are closely monitoring this situation. These officials are also in regular communication with the company, which has been cooperative and continues to share information with government officials. Any public health recommendations will be based on the information and any further inspections and from public health investigations. While many of today's cases appear to be linked to known clusters in southern health region and western Manitoba, notably Brandon, or are close contacts of previously known cases, preliminary information suggests that there may be a small number of cases with unknown acquisition in these areas, and this is what we term as a community-based transmission. Case investigations are ongoing. We have said now for a few days that these cases are a reminder that COVID is not done with us here in Manitoba. I'm aware Manitobans are concerned, especially as our reopening plans continue and we try to get back to living with this virus. Many Manitobans are very anxious at this time, and that is to be expected. But we can recall that we've been here before and we've never have been helpless against this virus. We have concrete steps that we can take to reduce our risk, and we've done them, and most of us have continued to do them as the time goes on, but we should make sure we get back to our focus on those fundamentals. Staying home if you feel ill, even mildly unwell. Practice good and frequent hand hygiene. Do not share items with others. Practice physical distancing when you're outside of your household. That's to remember to stay 2 meters, 6 feet from others outside your home. Especially when you are unable to physically distance, wearing a mask is very important. But again, you should be thinking about these crowded indoor environments where this virus spreads and has been shown to spread easily. These should be avoided, especially by those Manitobans that are increased risk of severe outcomes to COVID-19, those over age 65, those with underlying medical conditions, including respiratory conditions, cardiac conditions, and immune compromise. So we know these are challenging times, but it's obviously quite critical that we stick with our fundamentals to reduce the spread of this virus. The COVID-19 dashboard can help provide additional information to Manitobans. The dashboard has been online since the start of the pandemic. You can find it by going to manitoba.ca/COVID-19. We're also working to provide more detailed data on this website. We are working to be able to provide information that is broken down by health districts. Health districts are administrative zones within each regional health authority. This will allow us to break down case numbers in more detail while continuing to ensure the privacy of Manitobans. We expect that this more detailed data will be available later this week on the COVID-19 dashboard at manitoba.ca/COVID-19. Again, it's important to remind Manitobans to continue to be kind to each other. Stigma has no place in our society and certainly has no place in our pandemic response. It has many adverse effects on public health's ability to manage the pandemic. It decreases the likelihood that individuals will cooperate with public health, decreases the likelihood that individuals will go for testing. It may affect people's ability to self-isolate. So cooperation of individuals is essential in the way public health follows up on cases, and stigma decreases the likelihood of that. So please, we're all in this together. Let's be kind to each other. Let's focus on those fundamentals, but at the same time, being kind to our Manitobans. Again, we'll visit our website, manitoba.ca/COVID-19 for up-to-date information. And thanks again to everyone, and I can open up for questions.
Thank you, Doctor. This afternoon we go to our reporters on the phone first. And up first from Global, Eric.
Hi, Dr. Roussin. Thank you for taking the time today on a Sunday. That relates to my question. We know that there has been some criticism of the government for not providing very much information on the weekends. All of that has now changed. Is this just an example or a place for the government to provide us that information the public needs, or what was the decision-making process in deciding to hold a conference today?
Yeah, so I think it's a bit of a couple issues. So one is that we have been responsive to Manitoba's calls to hear more information, but then at the same time we've been seeing more cases that we've been announcing in the last bit. So we felt it was important to come out to ensure we have that voice for Manitobans to hear, to ensure that we're following up on these cases, that many of them are linked already to known clusters or to known cases. So we just want to make sure that Manitobans are informed.
And then, as a follow-up, can you expand on the small number of cases with unknown acquisition? Is that just something that you're investigating and it's unclear where they contracted it? I just trying to gain some clarity.
Yeah, so that's correct. So when we talk about these community-based transmission, or what we might term as non-epi-linked cases, a lot of times it's early in the investigation, so we just have yet to link them to a known case or to a cluster or to travel. So often the numbers that we report for that on Friday, the 7-day was 14. Often that can be an overestimation because we've just not had a chance to link them yet to that. But when we see cases that are linked to clusters or to known cases, that means these are individuals who have already been self-isolating. So they're unlikely to have significant contacts. The significance of a community-based transmission or acquisition is that those individuals have not been self-isolating. So they could potentially have many contacts.
From the Brandon Sun, Kyle.
Hello, Dr. Roussin. You mentioned that at least 70 new cases can be connected to a single business in Brandon. Are you at liberty to divulge which specific business this is?
No, we still are aware that the reports of a specific business are out, but we are still not naming that. Our typical practice is to specifically name a business when there is a potential public health exposure, and so that's to the public, and so that's not the case at this point.
Okay. And you can't reveal if it was Maple Leaf also?
I'm sorry?
You think you can't reveal if this is connected to the Maple Leaf pork processing plant either?
Yeah, right. So these are the cases that we've been following. We've been discussing a cluster in the Brandon area. We've discussed a business that a number of cases have tested positive, although most as of right now of those acquisitions have been determined to be in the community, and so we still don't see evidence of workplace transmission at this point, but we're still investigating.
From the Brandon Sun to the Winnipeg Sun, Scott.
Hi, Dr. Roussin. Just to be clear, just piggybacking off of the question from the Brandon Sun, is it 41 cases now then at this unnamed business that you won't name?
Sorry, what number did you say?
I'm wondering if it's 41 cases now at this unnamed business that you aren't naming.
No, the around the 40 number there is the cluster in Brandon, and only a small number of those have been linked to a workplace. So the bigger number is a cluster in Brandon. A much smaller proportion of that, those individuals happen to work at a specific place in Brandon.
Okay. And the other question is, I mean, we're obviously seeing quite a few number of cases in that region. I guess, people are wondering when masks are going to be mandated, if they will. We're still kind of, it's kind of in limbo here. You're telling us to avoid indoor crowded spaces, and if you can't, wear a mask. I mean, why not just tell people to wear a mask?
Yeah, well, we are advising people to do that in those specific situations. Mandating things is a much different picture when we start mandating certain behaviors. The issue here is with masks, they are in addition to the factors that we have in place, those fundamentals. They are not alone going to be the answer to this pandemic. So physical distancing, the need for physical distancing, the importance of physical distancing, the importance of avoiding crowded places, especially indoor, is not going to be avoided by the use of masks. So it's vital that we get that message out. If we are physically distancing, if we are avoiding crowded indoor places, if we are performing hand hygiene, adding the use of masks will add some benefit to us. And so it's important that our messaging relates to that. So I think that the key is that the fundamentals are important. We've broken down some more specific regional data, now talking about a cluster in Brandon. So it's really important to practice those fundamentals there. The issue that public health has mentioned though all along is that it's not any less important to practice those fundamentals in Winnipeg right now. So I understand the desire to hear more specific information, but it really shouldn't change anything we do. We should all be sticking to these fundamentals, whether we're in Brandon, whether we're in Winnipeg, whether we're in another region.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin. So we're seeing, spikes in, more rural areas, and I'm wondering if there's any potential plan to implement a phased approach to reopening in the province, or maybe even roll back some reopening, or however we loosen restrictions in certain areas to reinforce, I should say, a lockdown restrictions in certain areas. Is a phased approach potentially being considered?
So a good public health response, any options are never off of our table here, so we are reviewing things like that. Certainly as we move forward into these increased numbers and especially as we get into respiratory virus season, our plans were to have a much more targeted approach to increased interventions. And so certainly we could see things like that where we may want to avoid widespread restrictions as we did as we first started dealing with this, and maybe targeted restrictions if necessary. So nothing's off the table. We don't have immediate plans for that in this situation, but those type of more targeted interventions are what we're planning for.
And if we do see a continued increase in spikes in the same vein, would a province-wide rollback be on the table? Could we be, going back to where we were 3 months ago if the case count keeps going up?
Well, I mean, we're not going to take anything like that off the table. Right? We're going to do what we need to protect the health of Manitobans. Certainly, our goal, and we've learned a lot about this virus. So our goal is to avoid widespread restrictions. Our goal really is to find ways to live with this virus. And if we really practice these fundamentals, we're really in a position to do just that. But if restrictions are going to be required, then we are going to be looking at more targeted, if possible.
From the Winnipeg Free Press, Gabrielle.
Hi, Dr. Roussin. I was wondering, do you think telling people to avoid crowded indoor spaces, does that qualify almost as a new warning?
Yeah, well, I think that it's fitting with a lot of things we've been saying. This virus is spread predominantly by close, prolonged contact with people showing symptoms of the illness. And so we have a multi-layered approach that can reduce the limit of that spread. So one, like we've been saying, is that if you have any symptoms, even mild, stay home. Certainly get tested, certainly seek health advice if required, but don't go to work, don't go to school, don't be out in public if you have symptoms. The other is avoid close, prolonged contact with others. And so that's where the physical distancing messaging comes in, that 6 feet, 2 meters rule. And then we know that in crowded, especially indoor places, that's where we see a lot of transmission. And so definitely it's a reminder that those venues need to be avoided. Because we know we've seen transmission events in those venues.
Okay.
And I'm sorry if this has been answered already, but how many cases in Winnipeg were there as of today? For new cases?
Yes, of these 35 that we've announced today, 4 are in the Winnipeg Health region.
Thank you, Doctor. We now go to room 68 and questions from our reporter on the floor.
Hi, Dr. Roussin. Bryce Hoy from CBC Manitoba. Cases are going up here, so is our test positivity rate. So I wonder, how concerned are you about that? It's creeping up every few days.
Yeah, and so we've, our concern has never gone away. We've seen a period of lower numbers there, but we knew that we weren't going to be done with this virus, that we had to find ways to continue to articulate to Manitobans that we had to be careful. And then so certainly as we see these numbers go up, we're going to increase that messaging. We want to ensure that Manitobans are aware that this virus is spreading in many communities, so we have to be careful. Test positivity rate, like you mentioned, is one that has been trending upwards, and we're following that really closely. But again, we don't follow just a couple indicators. We follow a number of indicators. When we see the test positivity rate going up, but we know that the majority of that test positivity rate is still to linked individuals, then that's less concerning if that was a widespread community-based transmission. But certainly we're at a point where we need to message to Manitobans. If we hadn't been following those fundamentals, we have to get back to them.
Okay, similar vein. Yesterday we had 148 active cases. Today we have 183. How concerned are you about that, and what that message maybe is sending to Manitobans as fall nears?
Right. So when we talk about the total case numbers, the issues with that is one is the public health capacity, because we follow up with all those cases and there's contacts. So as we see those numbers go up, then so does the strain on that system. But it's been prepared and been preparing for quite some time for those type of issues. The other thing is that we know that a relatively small but predictable amount of total cases have severe illness and severe outcomes. They require hospitalization or ICU. So certainly we see our numbers, the stress on the healthcare system is not elevated at this point, but we know that there's a lag time to that, that it's too early to say whether this total case count will have an increasing effect on our healthcare system.
I've got another. We are talking a lot about Western Manitoba these days with the Brandon cluster. Maple Leaf has been obviously involved in this a lot, and there's been lots of questions, but I wonder how many businesses are you aware of in Brandon that have employees that are working with the public, say in the food industry or elsewhere, that have had positive cases recently?
Yeah, so things like that, the way you phrase that question, if we're aware of a positive case that has had interactions with the public during their infectious period, those are precisely the ones that we make public. So there are recent cases that, many cases have employment. If they weren't at work during the infectious period, if they weren't working with the public, then we don't announce that. There really isn't a benefit. We've had, cases that at some point attended daycare, but they didn't attend daycare while in the infectious period, so we don't make that public. So there's lots of workplaces throughout this entire pandemic that have had employees that have had COVID. The vast majority of them haven't been there when they were infectious, so we don't make that announcement.
Can you tell me anything about reports about a case at a business in Steinbach? Hearing some sort of whispers about that in the last day or two, and I've seen a release from the company in question that's basically gone out to staff confirming that. So.
Yeah, so I don't have any specifics to discuss there. What we've seen in a number of cases and where businesses have gone above and beyond what public health have advised. So in public health, that does that case investigation if there's a positive case, but we're sure they haven't worked during that infectious period, which we determine 48 hours before the onset of symptoms. Then we don't make a public recommendation. We don't make a recommendation to the business to close. So if we do find that, we'll make that public.
I recognize that this might not be fully within your purview to do, but back on Maple Leaf, to my knowledge, the business is still operating. There has been calls to, maybe close it in some sort of abundance of caution, given the fact that we've got a number of employees who have tested positive now. I know you said today, and you said in recent days, there isn't really any evidence of workplace transmission, but what is the trigger, the threshold where you'll know definitively, look, that is workplace transmission there and something has to be done?
So a couple questions. So if we look at what would be workplace transmission, so if we find an individual who is only contact or suspected contact to a case would have been within the workplace and they develop symptoms, then that would be something that we would determine as workplace transmission. If we're unable to link that anywhere else and we know they were a known contact within the workplace to that. What would require us to take other action? Well, we don't have a specific threshold on that, right? These situations, cases are different, the specifics are different, so all of these would require a detailed investigation, but I can't say it would be one or it would be two or it would be three. It really depends on what we see. What I can say is that if we see evidence of transmission within the workplace, then certainly we need to start looking at why that's occurring and what we can do to stop it.
Thank you, Doctor. We're going to go back to the phone for a few questions. If our reporters on the phone have any, please proceed.
Dr. Roussin, Scott Billick here with the Winnipeg Sun again. If we're going by reconciled numbers, today is the most cases in a single day reported. It's also the most active cases now that we've had in the pandemic. We're coming up on doubling the amount of total cases that we had about a month ago when we only had one active case. What's happened here in the province? Where has this kind of gone wrong? Is this a second wave? I mean, what is this?
Yeah, so this is, you can see that predominantly this is related to a number of clusters. And so this is what happens when this virus gets into situations where there's potentially crowding or a lot of contacts, then we'll see increased numbers like this. So for the most part, it's been contained within clusters and known contact chains. But this is exactly what happens in those situations, that this virus has never been gone. We've always remained at risk to seeing this virus. We just need to continue to practice those fundamentals and to ensure we're doing whatever we can to find cases early, have them isolating, find those contacts early, have them isolating. Then we're going to see cases, but if they're linked, then that's going to get us to that area where we can control the transmission of the virus.
What hope is there, or what optimism is like? What message of optimism, given the current situation, you have for Manitobans right now?
Well, I think it's what we've been saying right at the beginning when we started these, is that we're not helpless. We all know right now on the things we can take to today greatly reduce our risk of contracting COVID-19, right? And you've heard me say them: washing our hands frequently, physically distancing whenever possible, staying home when we're ill, wearing a mask in situations where we may not be able to physically distance, but really avoiding those crowded places. So we've never been helpless against this virus, and we certainly aren't right now. And so we can each take those steps right today as an individual, as a business, to protect ourselves and others.
Hi, Michael Delamonte here again from CTV. Apologies if you've already kind of said this, but just if you can reiterate or clarify this cluster in Brandon. Is there any insight into how it started? Did it occur because individuals didn't properly self-isolate for 14 days? What can you tell us about that?
Yeah, and so we've talked before about a traveler from out east that is potentially related to this, which did self-isolate, but may have had some household exposures. It's not clear necessarily whether that was the start of it, but it's certainly a potential link to it. And then we just look at the initial cases. There were many contacts with them, in and around the geographical area, and this is what we see. So a lot of those have been named contacts, and so they were self-isolating. But the actual origin of it, we may not be able to significantly identify.
Scott Bill from the Sun again. A lot of the numbers went down when we were under lockdown, or at least more measures and more restrictions in place and stuff like that. Can we expect the same numbers or the same decrease in cases, active cases, all of that, with the openings that we have right now, with the very I would say few restrictions that we have in terms of where people can go, travel to, etc.?
Yeah, so we had some significant restrictions at first. We needed to respond to a pending pandemic here, so we had some very significant restrictions on. We've learned now the things that we can do to prevent the spread of this while not requiring those significant restrictions, and so we'd like to be in a place where we can continue to have avoid the quite significant restrictions, but just have the precautions put in place that we've all benefited from before. So nothing's ever been off the table. We're going to protect the health of Manitobans, so restrictions are always an option. But like I said, we really want to be in a place where we can live with this virus and not need to have dramatic restrictions as we once required.
Dr. Roussin, can you just, for me, one more time, can you clarify how many cases are linked to the Brandon cluster, and then specifically to Maple Leaf or the Brandon business you've mentioned?
Right. Yeah. So I don't have the a current number to give that to you, just because a lot of these that we report down to 35 are still under investigation, and so we know that there is that significant cluster in Brandon, which was approaching that number of 40 and may have exceeded it, and then a small proportion of that are people who happen to work at that business.
Okay. Just on a tangentially related note, we have Maple Leaf It's a big plant. It's indoors. You might say that a place like this, you get crowds occasionally. Obviously, workplaces are taking all sorts of measures to ensure distancing, but what would be the harm in, say, enacting, hypothetically, one of these targeted community-level measures where you mandated masks indoors for spaces like this?
Yeah, well, this company and a lot in this industry have been going above and beyond. So there's a lot of PPE use. There's a lot of distancing and barriers at play. So we've, like I said, we've had this place investigated or reviewed by CFIA, Manitoba Agriculture, Public Health have been in there, and so the measures in place are quite good.
Thank you, Doctor. And this concludes today's media briefing.